difficult in the setting of endo and hip. There can be a lot of a chicken or egg question. And you don't necessarily know if it's the hip triggering some of this pelvic floor reaction, or if it's something like endo that's sensitizing the nervous system, which is amplifying the sensation from the hip, which really isn't that bad, because a lot of people have labral tears. They're just not problematic. So you don't really know if it's a true problematic labral tear or if it's just sensitized from what's going on in the pelvis. So how do we figure this out?
So for many patients, like for men, it's a little bit easier because you're knocking out endometriosis, so it's a little bit easier. And for in the location of where they're having pain, if you're looking for hernias, for men, it's looking for hernias and for and tears in the hip, and then the pelvic floor. And females, it's hernias, hip, endo, ovary, you can keep going. There's like a billion things that could it be. And then bladder, like you don't know, and then that's how we do a lot of diagnostic imaging and a lot of diagnostic tests, procedures to rule out things, which helps a lot. Sometimes, I'll do an injection of an ilioinguinal nerve block, and someone who thinks they have endo or their ovaries the problem, and then all of a sudden they're feeling better from a nerve block. That doesn't make sense. I'm not getting anywhere near endometriosis. I'm definitely not touching their ovary. So they think that it's their ovary, and then we do a nerve block and it goes away. That's like kind of clear that it's not the endo.
And similarly, if we treat the hip, if we inject the hip and it gets better, that's a good answer.
Mm-hmm.